Mr. Daly died at 12:15 p.m. on the 16th of September. On the 13th and the 14th, he had complained of moderate to severe pain, but received no analgesia. On the 15th and the 16th, he received only one dose of morphine at 9 a.m. each day. What's ethics got to do with it? Mr. Daly's is not an isolated case. According to a recent study released by the U.S. Department of Health and Human Services, 94% of for-profit nursing homes and 88% of non-profit nursing homes were cited for violations of federal health and safety standards in 2007. In the two for-profit nursing homes in which we conducted the study, 64 of the 117 terminally ill residents were either admitted with or acquired a pressure ulcer after admission. Of these, 52 died with a pressure ulcer. Given the system-wide failure to provide adequate care, what do ethical questions have to do with what happened to Mr. Daly? His case is shocking, tragic, and disturbing, but aren't changes in the system required, which will enable changes in practice rather than a discussion of abstract ideals? Someone reading this case study could conclude that no single person or group of people is entirely responsible. After all, many actions and inactions contributed to the outcomes of pain, weight loss, loss of dignity, worsening pressure, ulcer, and death. Should we focus on the for-profit corporation that owned the nursing home, the administrator, the director of nursing, the treatment nurses, or the CNAs? Should we consider the fact that understaffing resulting from cost-cutting measures led to the demoralization of staff and poor outcomes? What about the fact that lobbying by corporations that own many nursing homes today undermines the enforcement of the numerous federal regulations intended to protect patients like Mr. DeLay? How relevant are our dismay and outrage at the insensitivity and lack of knowledge shown by many of the CNAs caring for Mr. Daly? The danger in healthcare is that sometimes people begin to accept the way things are and feel helpless to make changes. Perhaps this is why ethics are not given much emphasis in nursing schools and are often considered too abstract for practical application. Resources are limited, you can't change the system, and might actually get in trouble if you try to do so. In metropolitan areas, the fact that there are thousands of places to work may make it easier for individual nurses to challenge the status quo. In some less populated areas, however, there may be only one or two possible employers within commuting distance of many nursing homes. What would you have done differently for Mr. Daly if you had been the director of nursing, one of the treatment nurses, or the administrator who was also an RN? First, let's look to whether Mr. Daly's care violated any of the provisions of the 2001 Code of Ethics for Nurses set up by the American Nurses Association, ANA. Provision 3 states, the nurse promotes, advocates for, and strives to protect the health, safety, and rights of the patient. The accompanying interpretive statement notes that the nurse had a responsibility to implement and maintain standards of professional nursing practice as an advocate for the patient, must be alert to and take appropriate action regarding any instances of incompetent, unethical, illegal, or impaired practice by any member of the healthcare team or the healthcare system that places the rights or best interests of the patient in jeopardy. The nurses didn't promote and protect Mr. Daly's health, safety, or right to pain relief. Prevention treatment of pressure ulcers required nutritional assessment and support, management of tissue load, how pressure is distributed on tissue, and ulcer and infection care. Pain management is also crucial. Nutritional assessment and support. A person with a pressure ulcer needs adequate nutrition to promote healing. The form for the minimum data set, the clinical assessment that must be followed by all nursing homes receiving Medicare or Medicaid, which must be completed within 48 hours of admission to a nursing home and quarterly thereafter, has a section on assessing oral and dental status. Mr. Daly wouldn't have lost 29 pounds if the staff had assessed him adequately, obtained dentures for him, or served him food he could eat, and assisted him properly at mealtimes. Tissue load management. The corporation that ran this for-profit nursing home didn't staff it adequately. The director of nursing said Mr. Daly's pressure ulcer had said of Mr. Daly's pressure ulcer, he has to be off his back. She knew that pressure relief and proper repositioning were important principles of pressure ulcer care, but she didn't ensure that they were adhered to. She also said that because of inadequate staffing, it was difficult for the CNAs to get someone to help them when residents needed repositioning. On only one occasion during our 30 visits was Mr. Daly positioned properly. Laying on his back at a 30 to 90 degree angle placed great pressure on the ulcer, resulting in pain and additional damage. Furthermore, the tunneling might have been prevented if there had been a mechanical lift to assist the CNAs in repositioning him. The CNAs were not instructed to ensure that 2 staff members, rather than 1, carefully lifted him in bed to prevent shearing. Shearing can cause distortion in the blood vessels in the sacral area, causing tissue to become ischemic and necrotic. Improper repositioning undoubtedly contributed to the extensive tunneling and exposing of Mr. Daly's coccyx, which caused him great pain. Ulcer care. Because of his pressure ulcer's location, protecting the wound from fecal matter would have been challenging, but Mr. Daly's diarrhea was not treated, and no attempt was made to prevent feces from entering the wound. Although necrosis was evident, a debriding agent was not obtained. Lack of attention to these problems contributed to the pressure ulcer's failure to heal. Pain management. Although Mr. Daly often complained of pain, he received inadequate pain medication despite its having been ordered. When he requested medication, he sometimes had to wait a long time before it was given, and even when he was given analgesia prior to dressing changes, inadequate time was allowed for it to take effect. Provision 4 reads, "The nurse is responsible and accountable for individual nursing practice and determines the appropriate delegation of tasks consistent with the nurse's obligation to provide optimum patient care." The interpretive statement notes that when delegating nursing care activities to others, the nurse must assess the knowledge, skills, and experience of the individual to whom care is assigned and monitor and evaluate the quality of care provided. Federal regulations require certified nursing homes to have a director of nursing, an RN, on duty for only 8 hours a day and only 1 licensed nurse, an RN or LVN, on duty during the evening and night shifts. At this nursing home, the director of nursing usually worked from 8 a.m. to 5 p.m. Therefore, much of the residents' care was delegated to CNAs who had limited knowledge and may also have been responsible for more patients than they could safely care for. Since federal regulations allow nursing homes considerable staffing flexibility, stating only that they must provide sufficient numbers to care for residents. Training and supervision of staff are paramount in nursing homes. The director of nursing knew that Mr. Daly wasn't being turned in bed, but did nothing to teach the staff about importance or supervise them to make sure that they did. And while she knew the CNAs didn't ask for assistance in repositioning Mr. Daly, she didn't tell them that it was imperative that they seek help to do so. Pressure ulcers are a major problem in nursing homes. However, during the 30 months that we collected data, we never heard about a single in-service education program on preventing and managing pressure ulcers. One CNA said she didn't understand how the pressure ulcer had become so large. He had a bad sore on his back, but didn't know what had caused it. If the CNAs don't understand the reasons for relieving pressure over bony prominences and providing adequate nutrition, and if they are not properly supervised and held accountable for doing so, the quality of care they provide will be compromised, especially if they are overburdened. Staffing. Many of the nursing home staff worked double shifts even when they preferred not to do so. An RN confided that she had worked 90 hours in 1 week, and a CNA stated that he had worked 50 days without a day off. For the daytime shift, the licensed nurse-resident ratio was 1 to 15 in the evening, it was 1 to 22. At night, it was 1 to 45. If someone called in sick, the ratio worsened. On one occasion, one LVN was responsible for the care of some 40-some residents on the day shift, and when staff didn't report for work on the evening shift, 1 RN and 2 CNAs had to care for them. It is the duty of administrators and directors of nursing to ensure that enough professional nurses are available to provide the necessary care. Although nurses may be reluctant to ask for additional staff for fear of repercussions, it is our professional responsibility to do so. During the study, an administrator at another facility closed a unit and refused to admit patients because he didn't have adequate staff. He was not fired, as some of his staff expected would happen, but instead gained the respect of the facility's upper management. Nurses should refuse to tolerate a work environment that prevents the delivery of high-quality care. The ANA and the Academy of Nursing should take a position on this problem and provide leadership and support to nursing home staff who now feel that they are battling it on their own. Provision 2 says, the nurse's primary commitment to the patient. Section 2.2 of the interpretive statement continues, nurses are frequently put in positions of conflict arising from compelling loyalties in the workplace, including conflicting expectations from patients, physicians, colleagues, healthcare organizations. Reporting. Nurses have an ethical responsibility to intervene in all healthcare settings when the environment contributes to unsafe, inadequate, or unethical care. Researchers and staff can report unsafe conditions to the State Department of Health and to the state or local ombudsman. The National Citizens Coalition for Nursing Home Reform is an advocacy organization that can provide help and information. See their webpage for links to every state's ombudsman. Provision 1 states, the nurse practices with compassion and respect for the inherent dignity, worth, and uniqueness of every individual, unrestricted by considerations of social or economic status, personal attributes, or the nature of health problems. The interpretive statement notes that the measures nurses take to care for the patient enable the patient to live with as much physical, emotional, social, and spiritual well-being as possible. This is particularly vital in the care of patients and their families at the end of life to prevent and relieve the cascade of symptoms and suffering that are commonly associated with dying. Mr. Daly's care lacked compassion and respect. In the final days of his life, he was allowed to overhear statements such as, there is always poo-poo in the bandage, and I can't imagine he'll live much longer with a sore like that. Nor did he receive the pain control that was his right. A recent study found that lack of knowledge, inadequate staffing, and poor nurse-physician communication contribute to inadequate pain management in nursing homes. While these factors suggest that pain management is a systematic problem, it is difficult to understand why Mr. Daly was not medicated properly by those who heard him crying out in pain. Good care is everyone's business. After Mr. Daly died, his wife told us about the last days of her husband's life. The night before he was to go have dialysis, he had always told her to go get his clothes out for him so he could dress for it. Just the day before I gave him the okay to stop dialysis, she said, I asked him if he wanted me to lay out his clothes, and he said no, he didn't want me to get the clothes out. I figured he just didn't want it no more. It is by now widely accepted that when nurses work long hours and don't get adequate sleep, they and their patients are at risk for injury. Mr. Daly's case drives home the often repeated point that increasing staff to resident ratios is imperative. Inadequate staffing in nursing homes has been a problem for decades, and numerous studies have documented its importance in both the processes and outcomes of nursing home care. Elsewhere, colleagues and I have described how inadequate staffing contributes to malnutrition, dehydration, weight loss, and pressure ulcers. What are the consequences for nursing home residents if the nurses and CNAs are fatigued, overburdened, and frustrated? And what are the consequences for caregivers of knowing that they are unable to provide a high standard of care? When stressed, does their ability to be compassionate and caring decline? Fowler states that prior to the 1960s, the emphasis in nursing ethics was on virtue ethics, which focused on the character of the moral agent rather than on rules or duties. Nurses were expected to possess characteristics such as benevolence, care, compassion, kindness, and trustworthiness. We need to ask whether the ANA's Code of Ethics for Nurses is part of every nursing student's curriculum and taught in a way that makes relevant to everyday patient care. When nurses think about ethics, they tend to focus on dramatic issues as whether or not to prolong life-sustaining treatment. We may neglect the everyday ethics of care as illustrated in the case presented here. We do not contend that the nurses in this facility were intentionally unethical, but were they, and are the nurses working in nursing homes, acute care facilities, and other healthcare agencies and in other healthcare settings aware of the Code of Ethics for Nurses and integrated into their daily practice? Fowler also makes it clear that these virtues don't exist in a vacuum. The environment in which nurses provide care to nurture them and to allow them to flourish. Nurses and other professionals such as physicians, dietitians, social workers, administrative staff, and the management of the corporations that own the nursing homes must collectively take responsibility for providing ethical care and engage in collaborative efforts to prevent the problems seen in this case.